Good afternoon. Today is February 24th, 2023. Welcome to UMACO TV. This is Kemal Erkan. Let me make sure that we are all mute here. Okay, sorry. This is another exciting session for us. And today, our State Senator, Nicole Poore, is going to join me, and she's actually with me right now. Senator, how are you doing? You are on mute.
I'm wonderful. How about yourself?
Good, good. So we both had a little technical issue here. So, I do this almost every week now, so I should know, but I didn't mute myself. So, well, welcome to our session. So we start doing this. It's almost 2 years now. So one of the silver lining of pandemic that we went through, we actually wanted to reach out to public, mainly our patients, and also a lot of our employees who were remote, a lot of our physicians and other providers who were remote. We wanted to have a channel open, and we can actually reach out and make sure that they know what we are doing, and we can keep them up to date. Then it turned into this weekly event. So we cover mainly healthcare news, and sometimes we go to U.S. economy and the global news, anything that may be affecting our patients, we talk about those. So, and again, thank you for joining. And you and I, we were trying to get you on this for a while. So, but then I just realized that we are serving at the same board with the Brandywine SPCA. So that's where we met first time. So, and we want to make sure like you were part of this. Governor was with us 3 weeks ago, I believe, right, Sean? So, and then again, thank you for coming. So now, many people, they already know you, but there are some people, they may not know you or what you do. You have so many different responsibilities with the state Senate. So if you can actually just give us some background on what you do these days.
Sure, absolutely. So I'm Nicole Poore. I'm the state senator for the 12th district. I have just won another election and very proud to serve this district. It's also a district that I grew up in. So it's really nice to have the footprints as a child and then now as a mom, as a business person in the district. And so I have 3 children. I've been married for it'll be 28 years this year. We were very young when we got married. And so what brought me into the political arena after working for about 20 years in healthcare, a job that I absolutely loved, but was ready to take on some other challenges and do different things, and found an organization called Exceptional Care for Children back in 2011, where it is a long-term care medical facility for children that are medically fragile. Wonderful, wonderful place in Newark. And so I did some development for them, met a lot of legislators during that period of time. But I had worked in the healthcare arena with a specialty for managed service providers and vendor management. And so went to work for DuPont, handling their workforce solutions in the United States and Canada. Again, just some great opportunities throughout my career. And it was during that time that I had gotten a call to run for state senate. And it was not something that I had ever considered. I was used to the business world, used to making quick decisions, and creating strategic plans. And so, but my husband was the one that encouraged me to do it. He was like my force to be reckoned with in the regards to running for office. He was like, this is exactly, what you want to do in life, Nicole, because you are too busy trying to take care of everybody, and this will give you the platform to do it. So, but throughout my career and during that time, we have raised 3 amazing children. Nicholas is 24. He was born prematurely, and so he is severely disabled with a diagnosis of cerebral palsy. And then our daughter is 23, and she is in her 2nd semester of law school. And our youngest, fingers crossed, will be heading into conferences this weekend for wrestling, and in a week from now, he will wrestle. And so far, he has had 3 state titles. And so hopefully next week will be successful for him.
Your plate is full with all these family responsibilities, business, politics. So now I know you are the co-chair of the health committee with this.
Yeah.
And I know that you had a business in healthcare staffing, right?
Yep.
So
Yep.
there's the healthcare background, and not to actually make this personal, but I actually didn't know that your son's situation, but that probably you had to be involved in what's happening in healthcare because of his situation. Because I know we have some of my friends have similar situation, and they had to actually work with the state in some cases. Mm-hmm. In some cases, they have access to care issues, and now this makes a little bit more sense why you would be in the healthcare committee. Now, in terms of the state, what's your outlook for 2023 for the healthcare providers, physicians? Yeah. Most of our people are going to be either our patients or our physicians who are watching. So what would you tell them for 2023?
You know, we don't just have a crisis in the state with behavioral health. It's a national crisis. And so with support, actually with the lead from Representative Longhurst, the House representatives, there are quite a few, Representative Mimi Brown, Representative Griffith, Representative Carrie Harris. There's so many of us that are talking about behavioral health. And then on the Senate side, our chair, Senator McBride, has certainly, just been on point with the fact that we need to talk about how we're taking care of our families, how we're taking care of our children. And coming out of the pandemic, it's certainly been really tough for a lot of families out there. And so you're going to hear us talking more and more about that. And, what that relates to is it relates to education. It relates to our workforce. It relates to just everyday living. So you are going to hear a lot more about that. And, of course, there are a whole other host of things. And one of the things that I think we started talking about the day that we met is, as women age and talking about the transitions of life and menopause and weight gain and just the different outcomes of what that brings to our everyday living with the hot flashes and everything.
So, well, actually, you made the perfect transition to the clinical side. So I had something for that, but I'm glad you did it because it's perfect. So I'm going to let Dr. Belicena and Donna Gunkel in our conversation. And after if we still have time, maybe we can discuss some of the other issues on the politics. So let me get them here. All right, so we'll have 2 individuals. So because when you actually asked me that day, so I'm not an expert in, there are some expertise that I have on the clinical side, but I'm not a clinician. So as soon as you told me, you made that suggestion, I said, okay, I have to have one of my physicians with me. Yeah. So, and I have a couple of them that I can go to that I'm comfortable with. So Dr. Maricar Belicena is from United Medical Clinic. So she's been practicing in Delaware for a long time. Dr. Belicena, how are you doing?
Good. How are you? How's everyone?
Good. So, and then Donna Gunkel is my partner in crime who doing a lot of clinical presentations with me. She's in charge of our clinical integration. She's a nurse, trained nurse, and she's running our clinical integration department. Donna, how are you doing?
I'm good. Thank you, Kemal.
So today is one of those days, we have in healthcare, we have sometimes these comfortable topics that we discuss, and we get into these not so comfortable ones that everyone knows, but no one wants to solve. So menopause is one of those topics. And I think this would be a really good platform, and I was hoping that Dr. Belicena can actually lead this and then give us the background on menopause, and then we can actually have some dialogue around that.
Sure. So basically, menopause is a point in time in a woman's life where there's a transition. So it's a transition between reproductive age and what we call climacteric age. And it can span between, typically from 45 up to 60 years old. But for sure, this can happen, This can happen earlier depending on what the situation is, whether it's surgery or any medical problems. But I would like to talk about what is typical, not necessarily normal, but typical. So usually starts between 45 and then expected to occur between 10 to 20 years old, 10 to 20 years. And typically patients come in because they have hot flashes and night sweats. That's the number one reason why patients complain, because sleep is affected, number one, concentration, they're irritable because they don't have enough sleep. It has a very, the impact on the socioeconomic and relationship situations is very big for this. And people don't realize this because of those symptoms. But I would like to stress more on the cardiovascular risk that these patients or women have when they come into menopause, because estrogen confers a good risk factor for cardiovascular risk. So if you look at the risk factors between men and women, it's not so much higher in women when they are still childbearing. So, but once we go into menopause, I included, our risk for cardiovascular events increase. So that means stroke, high blood pressure, cholesterol, those things exponentially increase. So it's very important that we try to educate women that they need to make sure that, if they don't check their blood pressure, that needs to be checked. Lipids, cholesterol needs to be checked as well. And they need to exercise. If they're smoking, that needs to stop or, wean off. And then they need to exercise, very important as well. And in the past, they did studies because the thought was, since estrogen was protective cardiovascularly, they did studies wherein they, in the nurses' studies wherein they put patients on estrogen. But apparently, estrogen is okay, like the estrogen and progesterone, if the woman has a uterus. So these hormone replacements are okay. In fact, they're the number one indication. Menopausal symptoms are the number one indication for hormone replacement. However, it's very important these are okay until they're 60. After that, the risk for other problems increase when they are on hormone replacement therapy. And that's only for women who do not have any other risk factors like breast cancer, or, ovarian cancer, those kinds of hormonally related cancers. So that's a different topic by itself. But in general, hormone replacement is safe for women who are less than 60 years old. And that's the small, in a nutshell, basically, for menopause.
Doctor, thank you so much for sharing all that, because it is true. We're not talking enough about it coming out of the pandemic. Women, like most people, were not going to the doctor. And I think it's just a conversation, and maybe because, I'll be heading into that in the next couple of years. But we need to take care of ourselves. We need to make sure that in order for us to be productive, taking care of our families and our businesses and anyone else that comes into our lives, that we have taken care of ourselves. And it's kind of hard. I have quite a few friends who are in the transition of this. Some have taken different options to be able to control some of the hot flashes. One of the things that I would love to touch on are the pellets. There are a lot of women out there today getting pellets. I hear there's great results from that. There are some women that are taking the progesterone and the estrogen just, orally. But I think it's definitely a topic of conversation, and we can't be afraid of it because it's going to happen to all of us at some point. But I appreciate your description of it and just hitting it head on.
Yeah. So,
guys, I have one question. It's not something that's happening overnight and then next day everything is okay, right? So what makes this challenging? Now, I did my homework, so I did a lot of research. So what's happening is this is a period of time, like it can be up to 7 years, 10 years. So it's a long time that you are going through this. So I think when I was doing the research on my side, that was the most maybe in a way frustrating part, because it's not something that you have it done in 6 months or 3 months. So this keeps happening. So then I was thinking that should we then discuss what are the ways to actually make this less painful for everyone? I say for everyone because while you guys are going through this, we live with you guys. So then I have my mom, I have 2 sisters, and then I have a lot of physicians, providers, and then I have a lot of people in the office. So we really need to be better educated without having a sign on the person, right? So understanding what may be going through on the other side. So I guess perhaps if we can maybe focus on the ways that we are handling, how should we be handling it clinically first, but also from the social side?
Yeah. So it's a case-to-case basis. It's not a cookie cut kind of situation. So it's really a relationship between the doctor and the patient. So the patient, obviously when the patient comes in and they're complaining about this, it's a problem because they will not come to the office without that, it's not a problem for them, so they won't go to the doctors. So the moment the patients complain, you need to do something about it. So then it's up to us to say, okay, what's your comfort level? Because it's not like a life or death situation, right? It's what's your comfort level? Mm-hmm. So bottom line, we explain to the patient. So let's say a patient comes in, she has hot flashes, night sweats, she can't sleep, she has no medical problem, she doesn't have diabetes, she doesn't have high blood pressure, she's not a smoker, she's never been on birth control, then I would offer, no question, hormone replacement therapy. That would be my first suggestion, because not all women, when you say hormone replacement, they're like, oh, wait a minute. They're like, no, I'm not going there. But, you try to tell them, okay, what if it makes your life 30, 40%, a little bit better, make you able to sleep, you can concentrate, that fogginess in your brain improves, and you're not irritable, you're not snappy, and they're willing to take it. And then I always tell them, okay, so you are responsible for this, and let's say take it for a year, and then after a year it's up to you, you can wean yourself off of it. So I mean, that when you say it that way, when you express it that way, it's more palatable for them and they're more willing. But that's when a woman has no other medical problems. Especially if they're a smoker, then you want to, counsel them on other problems because of the smoking situation.
Sure. So the patients who are coming to you, do they already know that they're going through something, or they don't know and then you are actually diagnosing them?
No, they know. They definitely know, yes. The only thing that I would say is, because women can develop hot flashes, night sweats, even if they're still having their periods on a regular basis. So that's a more, I would say, murky kind of situation. So it really, again, it's a relationship between the patient and the physician.
Yeah. Kemal, if I can just say, to all the women that are watching today, experiencing, as the doctor said, the lack of sleep, the fogginess. I've seen women have to almost strip down to get out of their clothes. And if you're sitting in a business meeting, it's a little uncomfortable. Or the back of the head starts sweating, and so the hair grows wet, or you see someone starting to fan. Like, these are all real, true life scenarios that are taking place with women that are, entering into the menopausal phase of their life. Again, as a woman, I've had 3 children. I think I've bared enough that I should be able to skip over this part of it. And the fact that you just enlightened me that it could last 7 years, it makes me, yes, it is probably not tolerable. It won't be tolerable in our home if I have it for 7 years, for sure.
Well, I also, sorry.
Go ahead.
I was going to say, so I think someone who's been through it, hopefully closer to the end of it, I think it is different for everyone, and it can vary from time to time, right? Because early on, I didn't have the sweats. I mean, I'll just full disclosure, I felt it more internal. So like my torso, I felt very warm, and almost like if you put your hand up, like almost like you could feel the heat like radiating off of me. So I didn't have it up here as much. But I've worked with people that would literally break out into a sweat, like you said. So I think you have to realize that it can be very different for different people. That was more for me. I did have the night sweats. That's where you wake up and you're like sweating, kick off the covers, and you're cold, and you're putting the covers back on. So it can vary. I mean, some days it happened multiple times a day. Other days, not as much. So, but yes, it has gone on for quite some time. And I think, again, being aware, and Dr. Belicena, maybe you can address this. I know for me, because I was only 45, but also your family and the history there, because my mom started very young too. She was less than 45. So I think also being aware of your family history and when, that may begin for you, could be earlier than for other people. So just kind of right, Dr. Belicena, it does, there is a bearing, like genetics, right? And family history can play a part in that as well.
That's a great point.
And it really varies. Initially, people can have like really bad symptoms, maybe I would say ballpark 1 to 3 years, but they dissipate. They really dissipate throughout, like moving into the 4th or 5th year. And some people, and the flip side too, like, oh, am I in menopause? Well, you ask a question, when was your last menstrual? I don't even remember. So is it more than a year? If it's more than a year, yes, you're in menopause, and they don't have any symptoms. I said, yay. And they asked me, do I need to take anything? I said, do you feel any different? And then, no, you don't take anything. They're like, oh, okay, because I thought I need to take something. No, you don't need to take anything.
Yeah. Dr. Belicena, what I think I also hear a lot of women talk about is the weight gain. All of a sudden, the weight gain is right in the midsection. And people will say, well, I eat healthy, I work out.
Yes, unfortunately, yes. So that you're like, I think if I could counter the gazillion number questions, that's all I've been asked about. So anyway, so what happens, obviously, when we go through menopause, I mean, women, we're double whammy, right? Double whammy. We have our kids, our belly becomes flabby because of all the things that we need to do. We need to wash the dishes, everything. We don't take care of ourselves. We don't take care of number one. So I always try to say, please exercise, whatever shape or form. Doesn't matter to me. We need to exercise, right? And not only that, as we, when we're there in the perimenopause climacteric age, it's important for us to do weight training, because women, I mean, men, because they have the testosterone, they have the muscle mass, right? But if we don't do weight training, our muscle mass diminishes, and that's responsible for metabolism. That increases our metabolism. So that's really number one. That's the key there. The hope is if we increase our muscle mass, then the chances of us maybe increasing our metabolism, yes, and then losing the weight. But that's like, I wish I wrote something, but because that's always what I'm eating less, I'm exercising more. I don't know why I'm not losing the weight.
Yeah.
Yeah.
It's a true struggle.
Yeah.
And, at least when you're pregnant, that you're getting a beautiful surprise at the end.
Right.
In this case, the surprise is that it's just staying with you and there's no end to it.
Yeah. So we have to take care of number one. It's not being selfish.
There's no good surprise here, right? So let me actually ask you guys, maybe just address a couple of different things. So one of the things is like engaging in mentally challenging activities, right? This is apparently helping to keep so the better positioning yourself. Let's say it's not going to make it a lot easier, but it will make it somewhat easier. So exercise and all those. But as I'm listening to you guys, one of the things that we see, Donna and I, we run case conferences, Senator. So part of our accountable care organization, every day we have 4 nurses, 1 social worker, 1 business development. She's running 1 team, I'm running 1 team. And what we have seen, and what I learned a lot is how our social determinant of health becomes like the main factor. So everything that you are talking, like I'm talking to 3 very intelligent, very well-educated women in the society. But if this person who's not in your situation, with the poverty, with other social challenges, this issue is even bigger for them than what you guys are going through or what you already went through. Is that right?
Not necessarily.
No?
No.
So like they
yes, it's not a problem. It's not, well,
what I meant was actually, like, what's coming. Let's say you are better educated on this, but then people who don't know enough about it, they may not know what they're going through, and then they don't know how to handle it. That's what I was.
From my experience, it's usually the more educated women that would complain, that would come in and say, yes. Okay. And because to them, probably because of other issues, it's not even worth talking about or not worth complaining because they have other problems to think about and they're just dealing with it.
But isn't that so interesting though? It's kind of like opposite of what we normally have in healthcare, right? So you are saying that they wouldn't actually realize what they're going through because they have a lot of other social challenges. Interesting.
Yeah, because what I find now, the women that come in and say something, about this is usually, they're working, they have a full family affair wherein, they're taking care of the children, but it's not because that they're not working but they're taking care like of four kids, driving these kids to all their school activities, but it's usually in the higher tier that these women complain. I mean, it comes after the fact. Like, when we do a review of systems, we ask this and this, like, do you have hot flashes, night sweats? It only occurs or it only comes up when I ask them, but they won't necessarily say that it's a problem for them. Yeah.
So then I'm again just thinking, since Senator also is part of the health committee, so perhaps we can maybe increase the awareness on menopause for those who may not have the same understanding or access to this. So again, it comes to the making them aware and they understand what they may be going through. This happens. Isn't this the same thing like with morbid obesity? Sometimes they never say anything about what they are going through unless physicians are approaching them. So it's kind of like similar to that. So that's actually interesting. So that's maybe something that we need to change our approach on our side. Now, so Senator was making some statements regarding the personal, what she was going through personally and what happens with the family. But the question would be, what do you suggest to the families or the friends, family members, how they should actually handle the situation? What's the best way to approach the issue, or should we not approach it at all?
So be kind, be nice, make sure that you are, doing all kinds of kind things for the women around you that could possibly be going through this. I think, right? I think I can probably write a whole list of things, but they would be the first things, Kemal, that I would encourage you as a man to make sure that you do.
That's important, because I guess
anyway, all the time, right? All the time, not
all
just
the time,
not just during perimenopause. It has to be all the time.
We're being 110% instead
right,
of
Donna?
right?
Exactly. I'm making light of it, because the reality is that I also would like to say that, oftentimes a woman may not realize that they're heading into this, right? Because is it perimenopausal, right? Where there might be some signs, but not necessarily because you might say, well, I'm only 45. There's no way I could, people don't go into menopause till they're 55, 60. And so they may not even realize that they're reacting, but it is something that chemically is changing in their body. And so I was making light of it, but just in reality to it, some women may not even realize that they're heading into this part of their life, and because they're basing it on the age. Because I don't know, again, that we really are talking about this. You hear women talking about weight gain, you hear women talking about not sleeping and hot flashes, but I don't know that that's a big conversation right now happening.
Yeah, and not only that, maybe, as you said, women aren't realizing this, but you're seeing a lot of depression and anxiety as well during this time, and without them realizing, yes, it could be perimenopause, menopause, and that, it could be dealt with differently, not just with, medications for depression or anxiety, but also to take a look at the hormonal level.
That's what I was getting ready to say, is I think being aware of that the hormones can make us feel different ways. And if you realize what's going on, or see a doctor to find out what's going on, then it makes you maybe better capable of handling some of those situations, right? Like some of the things that we would normally handle, very easily, and then we become more emotional in certain situations than normal. So again, being kind or being aware of what someone may be going through at that time.
But I think maybe what I was maybe also trying to say there is what I'm asking, should we also talk about it with them, or should we not bring it up at all? Like, I can be kind all day, so they know I'm always nice. But should this be discussed, or when should we discuss this? What's the right time to discuss this? So
and we're all silent.
So,
I don't think there really is any.
I'm trying to ask you uncomfortable questions for you guys, so that we can. Maybe there are people out there, they want to ask the same question. So I'll tell you. Okay. So I hope. Well, actually, my sisters are watching, but so one of them is older than the other one. So I'm one of 4 kids. So oldest and youngest are my sisters. So I want to be able to, I can tell you, I'm probably guilty of maybe making jokes about menopause. And I'm not going to lie to you. So Sean may lie about this, so he's here. But
I've never made jokes.
Other people may lie about this. But I'm just being honest, where we do make jokes about this, even to the person who's going through this. That's why now listening to this, and why actually we were even talking about this from the beginning, why we needed to talk about this from the beginning, because there's that social impact of this whole issue where we don't know how to handle it. Like when you say be kind and be nice, that's a little bit easier for me because I do love my sisters, but because it's family, sometimes we also kind of like torturing them with mean jokes. Should we even know that they are going through this? That's why I'm asking this.
Well, yes and no, because there's some women, they're freaking, like, I'm not in menopause. They really deny it. Like, no, So it's both sides. It's, as I said, you can't cookie cut it. There's really no right answer to that, because some women are, they're fine saying, I'm in perimenopause, menopause, and I have this, like, be nice to me. Some others know, like, they don't want to even talk about it. So
because they're very private, or like
yes,
they're either private and or they don't want to accept that they're going through it.
exactly.
And I think you kind of have to play off of it, and maybe more general questions like, are you okay? How are you feeling? Let them be the ones, like, based off a general question, let them be the one to bring it up. Then you kind of know where to go. But I don't know that I would have personally wanted someone to kind of ask me,
Exactly.
"Hey, are you going through menopause? Is that why you're cranky today?"
Well, I also think, Kemal, maybe men don't realize, or maybe people in general don't realize, when a woman is having a hot flash and they're taking layer after layer off, that there is a chemical reaction to whatever's happening in their body. I can speak for myself back in when we were having children. In order for me to get pregnant, I had to do a short stint of menopause through IVF drugs. And so I had the onset of the menopause and the hot flashes. And they could be pretty grueling, but sitting in a business meeting as you're sweating through your suit is not a very comfortable position to be in. And so you have to kind of work through it. And fortunately, no one said anything to me, but I'm sure they probably thought, wow, she is red like a tomato. And now she is down into like a t-shirt at this point from a business suit. So, but maybe just knowing what the signs are is just enough to reinforce, like, okay, this person is having some challenges at this time.
Oh, that's helpful. So what else would you like to share regarding menopause? Any suggestions to those who may be going through menopause or who are about to go through menopause? What's the best suggestion you would give them?
Also, on being nice to yourself too. Like, women are very hard on themselves, period. And they want to be, they want to present themselves in a way that, especially as you said, Senator, when you're in a business meeting, you have your, set preference. And then when these things happen, it's uncontrollable. You cannot control these things, right? So then it's on you. So then that's who I am, and deal with it. Like, it doesn't take away from who you are really. It's just a phase of life, and understand that it's going to get better.
Yeah. I love that. Right. Be kind to yourself.
We have to. We have to. Yeah.
And I liked whoever just mentioned a moment ago about the awareness, because I think, right, we spend a lot of time talking about other diseases and other illnesses, right? Awareness. We have Awareness Month for various different diseases. And I think you're right. It is an awareness that it can, affect people very differently. People can have, different symptoms. They can have some symptoms early. They can have worse symptoms than other people, but we have to be accepting of how they're feeling about their symptoms, right? So someone can have more mild symptoms, but maybe be feeling worse about it than someone who has, more severe symptoms. So I think it's just that awareness of allowing everyone to perceive that, for themselves, and to work through that.
I also want to stress another thing. Yes, this is finite. This will go away. It will get better for sure, but the risk for cardiovascular disease will increase. So that's what we really want to hone in and make sure that our women are being aware, that they're being counseled, that exercise, stop smoking, make sure you get your cholesterol checked, your blood pressure checked. Those things are critical, really, as we age.
I was going to say that I think the annual physical, not just for women, but for men as well, and just like for kids, everyone should be having their annual physical done, because those are time, because you want to be preventive. So you don't want to find out any type of issue, not just for this, prevention is the key. And like, because we covered so many different topics, the common elements are exercise, smoking, being positive, seeing support when it's needed, weight gain. So these are all the stuff that we find in many other health issues as a common element. So the best would be to be ready. So to get ready for any of these challenges. So I think that would be the key. Well, hopefully this was a useful discussion for those who are listening to us and to you guys. And definitely I learned a lot. And one thing that I know that I'm going to be nicer to my sisters. So, and again, this is just like learning and understanding what others are going through, just so that if we know more about what's happening, then we'll be able to also position ourselves better. And that's what we are trying to do from United Medical Accountable Care Organization side as well, because we deal with so many patients in different challenges. And one last thing I want to just reemphasize what Dr. Belicena mentioned earlier. People who have other social issues, women who have other social issues, social challenges, they are not even aware of what they are going through. And that actually makes it even maybe more complicated, not knowing what's happening. So we want to make sure that everyone has equal opportunity to understand and know better about what they are going through. Well, thank you again. So this was a very fun session for me, and hopefully we'll have others. And Senator, if you have a couple more minutes, I don't know how your time is. If we can go back to the politics if you want to cover anything on that side. So then I'm going to have these wonderful, beautiful ladies back in the waiting room. So Dr. Belicena, thank you so much again. And
thank you. You're welcome. Take care. Bye.
All right. So, one of the things, and then from your committee standpoint, maybe the social determinant of health is big. Mm-hmm. So we actually learned that early on. Even before it was kind of pushed out from the insurances and even from the governments. So we find out as we are doing the case conferences, cookie cutter approach is not working out. So there's I call these patients in some of these case conferences just to kind of understand what they may be going through, or if there's this one last attempt to see if we can help them. So we call the patient and then they are no-show for their annual physical. Then I call and then the person answers, the grandmother, and then she's like, well, I have surgery and then I'm the caregiver for my daughter. And then, because I'm sick, so she cannot get there. So no transportation, other difficulties, financial difficulties, food insecurity. So these, once we realize what we then have to do is to customize what we are doing based on the person whose social challenges may be different. So that's something that we learned, and I think there's more opportunity for us as United Medical ACO and the state of Delaware to work together. One thing that I want to mention to you, so this is kind of new, and there's no final. It's not finalized yet, but we started working with University of Delaware. The dialogue started, so we want to have these home teams. So with the nursing students, they will be able to maybe rotate with us. That's kind of our idea. So then they can actually become part of our care coordination team. So then the team of two, we can identify the patients. They actually can go to the patient's home. In some situations, unless you know where they live, how they live, you really cannot help them. Now, I can give you several different examples. One is like the trauma cases, like the hospital trauma cases. 50% are coming from one-level falls, like someone tripped on their rug and then they fell. These are Medicare patients who are elderlies. So if you go to their home and then know how they live, what their home setup is, you can actually help them better. And one thing that happened yesterday, again, so and this was a Medicaid patient, and on our bariatric program with the American Surgery Centers, we have also case conferences, same discipline on the ACO side. We have it on the surgery center side, and patient finish all requirements. And for bariatric surgery, we probably need to have a different discussion on this, where Medicaid patient needs to do 6 consecutive nutrition classes. So if they miss one, they have to repeat everything again. It's just reset. This person finished all those nutrition classes, cardiology clearance, pulmonary clearance, EGD, psych, primary care clearance, and blood work and everything else. So it's like a 6, 7, 8 months total of work that's been done. And she canceled the surgery twice. So then third time we are rescheduling, and I said, look, let's not reschedule. Let me actually call this person from the case conference. So, and she answers, and with my luck, every time I call them, usually they say, oh, they're not answering, but I call and they answer. And I said, tell me what the problem is. So what issue you are having? This is a Medicaid patient again. And she said, look, there's this diet that you have in the last 2 weeks of the bariatric surgery that prior to bariatric surgery. I cannot do that because I live in a home and they order pizza all day long. And I just go crazy and I break my diet. So, and we want them to lose a little bit weight before the surgery to make the surgery a little bit less complicated. So, and then she said, I was bullied at school. And, I'm just, I can tell that she needed some more support. Right. So if we don't change our approach with, this is, I would use this as part of the SDOH because knowing the patient, now I was able to change our approach because we have a program. That program says you need to do X, Y, Z. But then there's a person who's now a little bit different from that. So how can we actually understand that person, that patient, and then help them to get through this? So we talked and then we said, okay, so we are going to make some modifications. We are going to call and check in with the nutritionist 2 weeks. These are not sessions, just like support calls. And she was so happy. So I actually felt so great because I felt like I was able to touch someone's life because she was not going to go through the surgery otherwise. Right. So this is a young woman. We talk about menopause, and one of the complicating factor is weight gain, but she's already BMI 47. Right. So just think about all these challenges. So, and I really would like us to work together with the state of Delaware, with our ACO, to have meaningful discussions to change our approach, how we are handling our patients. And hopefully we can increase the quality and increase the better outcome from what we are providing as a service. So anything you would like to add?
Yeah, no, I think that, you never know what someone else's challenges are. And I don't think that people don't want to be healthy, that they don't want to take care of themselves, but life gets in the way. And so one of the things that you're very good at and your team is very good at is getting around the barriers, right? A person who is experiencing obesity, there are some other barriers in their life that has gotten them to where they are. So if you are basically peeling that onion back to figure out how to get down to the core of that person to help them be healthier, have their mindset be better, then you're doing exactly what needs to be done. But again, a lot of this is just conversation and education. But clearly people want to be healthy. They want to be active. The weather's getting ready to change soon. Yesterday was a perfect day to really, I think, raise people's spirits, get outside, walk around, walk their dogs. And so they're the things that we look forward to, but you need to have a healthy body to be able to do some of those things. We want people to have a healthy mind to be able to do these things. And so I think your program is a great example, and your story just now was a great example of how to get around those barriers to make sure that that patient comes in and finishes. Because you're right, 8 months, that's a lot of time commitment, a lot of time commitment. And obviously, if she has gotten through each step of it, it was time for her to do this, but there was something holding her back.
Yeah, absolutely. One last thing, I said it in the beginning, and I just want to make sure. I feel a little bit guilty if I don't cover that. So you and I, we work together at Brandywine Valley SPCA.
Yeah.
So that's one of our common interests. And I think what we have done there is amazing. So this new hospital,
Yes.
it's the first ICU for animals, and that our first in-person meeting, and I'm so glad that we had that. So there's something missing with the Zoom, like you have to really kind of have those in-person meetings, because that's how we are probably establishing better relationships with others. So there's
Absolutely.
It's a little bit artificial in a way, the Zoom. I mean, Zoom is great as a tool, but there's that other part that we have to really complete. So, but this hospital that we did, and the other day I was talking to one of my friends, and someone that they knew had difficulties financially and didn't have access to with their dogs, was going through some surgery, and they took the dog to Brandywine, to the new hospital. So I was like, I felt really good. I'm like, okay, so that's the hospital that we built. So when was when did you start with them? So you were probably before me, right?
Yeah, I think so. I've been on for the advisory council for quite a few years. As I came into the legislature, I was starting to see different bills take place in regards to our furry friends, and offering them protections, right? Like around how we're caring for them, how people should care for them. It's so sad when someone has to give up their pet, but it's even more sad when someone's not caring for their pet. And so we've had to create laws around that. Senator Walsh and Senator Hansen, Representative Williams have all been huge advocates in some of the legislation, myself as well. There's a lot to be said and going into that, but I got pulled in probably about 6 years ago. Judge Jennifer Ranji is the chairwoman of the Brandywine Valley Advisory Council. And she called me up one day and said, hey, I know you're not busy. So, why don't you join this council? And so, you know what, I thought, let me look into it. I am an animal lover. I am really particular to dogs. As a matter of fact, I rescued a dog a year ago. And just, he is so much a part of our family. I don't know how we lived without him.
I don't know how much you can see that.
I get. Oh, is that a golden doodle?
Yeah.
Oh, how adorable.
He's now 10 months old. So, my involvement with SPCA was Brandywine SPCA. I lost my first one last year. It was in March. So actually, in a couple of weeks, it's going to be his first anniversary. So as I was going through that, I mean, he was sick in the last 5 years of his life. So he still did really good, 13 and a half. But I knew how expensive to take care of the sick animal. And every time I was doing certain things for him, I was thinking about for those who really don't have means.
Mm-hmm.
And what do they do? Like how? Because losing him was, I still get emotional when I talk about him. So it's just 13 and a half years, so important for our lives, and like thinking about those people who don't have the same means, then not being able to give the care, and then they're going to put the dogs down. So during that time, Dr. Jonah Gora, one of our internal medicine down in Sussex County, she actually referred me to Tanner and Adam at Brandywine. And that's how I started with them. And I'm so glad that we did. But I'm also so proud of the hospital that we were able to finalize. So, and thank you for your time and commitments for that organization as well. Well, Senator, this was a really good session. Thank you so much again.
Thank you for the invite. I really appreciate it.
I'm sure we'll have you back again. And until next time, please stay safe. We'll see you soon.
Take care.